Here is how to drain the lymphatic fluid from your lower body. Hi, my name is Danny. I specialize in manual lymphatic drainage. If you want to learn how to drain your lower body and learn about your lymphatic system, give my page a follow and save this post for later so you can follow along in your home. Like all my other videos, we're going to start by opening up the 7 major lymphatic nodes. So starting at the terminus, just tiny stimulations below the collarbone or in that little pocket. Swallowing, coughing, and stomach gurgling are all expected, but it's okay if none of those occur. You still have lymphatic fluid, you just have a little bit of stagnation in your system if you don't feel those coming on. So just moving through the 7 nodes in front and behind the ear. And we're just wanting to open up these major pathways. So all that lymph fluid that we're about to move, when it passes through these nodes, it's properly cleaned. So really make sure that you go back and watch my 7 major lymph nodes video. It's pinned on my profile if you want a more in-depth tutorial of what I'm doing right now. Really make sure you're spending some time on the cisterna chyli here in the gut. Again, very light pressure. And then we're gonna move to the groin. That's just like this space right inside your hip bones. And then I'm gonna go here, and I like to kind of keep my knee bent and use this motion. Very light. I'm very lightly pumping. Right behind the knee, you can get what's called a Baker's cyst. I have a lot of clients that have actually experienced these where it's like almost like a hard little fluid-filled pocket that blows up behind the knees, and it makes it really hard to like bend your knee and stuff. I've usually found with my clients that have that, it really helps a lot to clear the lymphatic fluid out from this lower leg and from behind the knee. So once we've hit those major 7 nodes, we're going to be moving to the lower half of the leg. Now, since this is a pressure system, we want to open up those tiny little nodes on the lower part of the ankle before we continue to drain. So I'm just going to go ahead and move down to these little bumps on my ankle. These are called your malleolus or your malleoli. And I'm going to take my hand very lightly like this. And we're gonna do 2 parts to this dry brushing right now. We're gonna do what the first part is gonna be called a pump, and the second part is gonna be called a swipe. So that's what I'm calling it, a pump and then a swipe. So we're gonna pump that area. You got 600 to 700 lymph nodes all over your body. And there's little tiny clusters outside of those major 7s. For example, we got a little cluster here, we got a little cluster here, and we have some little clusters down at the malleoli. So I'm going to take my hands, very light pumping motion. Really behind the bone here in this soft pocket where the Achilles kind of sits, there's some soft tissue there. Spend some time with your 2 fingers just pumping very slowly. And then we'll start at the top of the thigh. You don't want to start at the foot and brush up because all of this is still clogged. So you're just pushing all that fluid into more clogged fluid. So let's change the camera angle and move down to the legs. Really quick before we move further, this type of full in-depth dry brush routine and manual lymphatic drainage routine does not have to be done daily. This can be done maybe post-surgery, post-injury, if you have scar tissue from any kind of surgery or injury there, when you feel it flare up, if you're a little bit overweight and you get swelling in the legs and the knees and the feet. So don't think this has to be done daily, this in depth, and this video is going to be longer because I'm explaining things. So you can do this on a quicker pace, once to twice a week. But opening your 7 major nodes should be done daily. It's super simple. I do it in the shower every day. So just think that this is like a once to twice a week, even like a monthly routine where you have time to give yourself a little bit more self-care and love, or you're recovering from sickness or an injury. Okay, hopefully you guys are at a good angle. We got my puppy's face in the background. So once we've opened up those 7 major nodes and the groin is open, if you have fat tissue here, just try to get in. Just get into some area and stimulate that. So I'm gonna kind of pull these up a little bit higher. A lot of our lymph is gonna sit on this inner thigh, kind of where we have more of that jiggle, right? Like I got a lot of muscle on the outside of my leg here. I'm not gonna hold as much fluid here as I am where my hamstring and my glute meet and on my chunky inner thighs. And most of us, even if you don't have muscle definition as I do, you're gonna hold most fat tissue here and most fluid here, right? On that midline of the body. So again, that motion we're using is kind of going to look like this outside of the skin. It's a very much of a pump. Now we don't want to jack the skin back and forth. We can kind of create a circle and a pull just like we would do on the face. But the direction of this lymph is all going to be up towards the groin. So don't push anything back down. Always start at the top so we can unclog this fluid and then move the rest through back to the groin, gut, and back into the body. So starting at the top of the thigh, I'm going to use like a two-handed situation, kind of like this. I'm going to pump in with this one and pump on top. And right now we're doing the pumping part of this drainage. So I'm really just trying to gently stimulate these. We can almost call this like a bit of compression. And I'm just doing it enough to stretch the skin. I'm not pushing down. This is not a massage. Everything's surface level. That water's right below the surface. So I'm gonna do some circular motions. Now, if you're like me, you know, I'm a little bit of a leaner athletic body type, but I have noticed close to my period, like the week before I bleed, my legs will look way more like they're filled with cellulite, and you can just tell I'm carrying water in them. So this is something I really take a lot of time doing the week before I bleed, because I'm just holding more water and fluid in my body in general, but especially in my lower body. So again, I'm swallowing a lot while this is going on. I'm gonna spend a little bit more time pumping the posterior hamstring here. I can feel I'm holding some fluid there. So I'm just gonna pump and pull. Pump and pull. And hopefully you can see how light my pressure is here. And we wanna move in quadrants. You don't wanna be moving all over the leg. So pumping and pulling. It's almost like a press in to compress, and then a pull towards the heart. I want you to think of like all manual lymphatic drainage techniques. It's like milking a cow. So you're just milking the udders of your lymphatic ducts. Now, I haven't had any knee injuries, but I deal with a lot of clientele who have major either double knee replacements, torn ACL, torn MCLs, bone spurs, you name it. Knee injuries is like the #1 thing I see. So even my client last night, she is the mother of 3 children. 2 of them were twins, dealt with a lot of issues when pregnant with the twins. Super swollen feet, varicose veins blew out in her calves. She's 6'1", so she's a tall person too. You know, and I could tell right away when she got on my table, I was like, your feet are really, really swollen. So we worked her lower leg, and she felt like a new person yesterday. She couldn't even speak after her session. She was literally speechless. So again, I spend a lot of time like repumping the popliteal node back here behind the knee, especially if you get a lot of fluid back here. It's gonna be really puffy, so don't dig in. Again, this motion. At that cadence too. Don't go pa 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 pa. We're not trying to pump it quick. It's a very slow, soft practice. So, you know, use this at a time where you have time to be present with yourself and give yourself the attention and love you need. So I'm gonna back up. We're moving to the calf now. Same thing. Now, obviously the anterior calf, the front of the shin here, that skin's gonna be a little bit tighter, especially if you have a lot of tension in the legs and you don't move your body a lot. I usually find all of that lymph is going to pool in the lower leg, especially if you have a little extra weight on you and you don't use your feet properly and you're wearing improper shoes with a narrow toe box. It can create a lot of dysfunction up the leg. So again, I'm just pressing and pumping. Literally like pumping and milking my lymphatic nodes. So really guiding all this fluid back up to my knee. My stomach's growling, so this is definitely working. And again, when I get down to the Achilles here, I'm gonna spend some time in this area, pulling up towards the heart. I deal with a lot of clients who have a lot of ankle sprains too. So you really wanna spend some time clearing the fluid around the ankle. And then the heel can get really jammed and stuck too. Every time this heel, this calcaneus gets stuck, this will lock up your hamstring. So I've noticed people have really tight glutes and hamstrings where the calcaneus gets tight. And there is lymphatic ducts in the feet here, guys. So spending some time mobilizing the calcaneus and the ankle. Again, I'm gonna kind of cup the heel here and use this very light pumping motion. I know we got thicker skin down here, but you still want to use that same very gentle sleeping baby touch. We're going to move to the bottom of the foot here, and I want to just again milk the bottom of the foot. You'd be surprised, there is a lot of fluid that I swipe from the bottom of people's feet. And this does not have to be a long routine. I have an 80-year-old client that came in and you could not see the bones on her foot. We threw the red line on for 5 minutes and I used my lymphatic brush and immediately her foot was drained. So now we're gonna be moving to like the big toe. Now my big toe, I've never injured my knees, but I've injured my big toe on this foot quite a bit in Brazilian Jiu-Jitsu. The toe is in Chinese medicine, it represents the head and the neck and the organ system in the body. So I want you to think of this part of the toe as like your shoulder blade. So I usually find people who have a tight mid back, this outside lateral little knob on the toe is usually quite tender. So I'll spend some time massaging that and kind of draining the lymph from there. And since I do have scar tissue in this toe, even up into the nail bed can get tight. The top of the toe is, think of it as your head and neck, even right here. And then this joint is like where your neck meets your shoulder. So I always like to mobilize the toes, but I'm gonna again use that pumping motion, especially around my injury site on this major joints here. So I'm gonna go the bottom of the foot and the top at the same time, and I'm using this motion. Like we're milking udders, but the udders are our toesies. And then hopefully you can see the top of the foot here. I'm gonna go in between each foot and get all this whole area. And now I'm gonna start using like a push and a wiggle, and then a swipe. And just really working my way down between all these bones in the feet so we can really get some definition here. Since my foot is tattooed, the fascia is a bit tight here because of the scar tissue. So I'm actually just gonna take a second, especially right here where they did multiple colors and multiple directions with the needle. I can tell the fascia is very tight and it does pull into these two toes here. So you can spend a bit of time vectoring the skin there and then just bringing that through. So I like to clear the foot like this. I like to swipe up to that malleolus. So I'll swipe all the way underneath and then up to the malleolus. Underneath, up to the malleolus. And then on the other side, I'll pull out to the side. I'll hit the calcaneus and then up to the bone on the side. So middle of the foot, back of the heel, up the Achilles into this little soft pocket. And now we're just gonna begin to swipe and dry brush. And hopefully you can tell the bones in my foot are a little bit more defined. Now this part, I like to think of brushing dust off of my body. So very, very light hands, like you're trying to put your baby to sleep or you're tickling somebody's back. I'm gonna spend a little extra time back here on the Achilles. This is where the soleus muscle attaches. The gastros are usually these big old chicken cutlets you see, and the soleus is that deeper muscle that can get really tight on a lot of us. Once you've cleared the fluid from that whole leg, you can re-hit the groin here and swipe all that up towards the belly button and then down towards the belly button, and you can re-hit those 7 nodes again. Make sure you spend time on the second leg as well. And then to finish, especially if you're dealing with low back pain and you're close to your menstrual cycle and you feel you're holding extra fluid in your legs, a bonus is to do this next thing. I love doing this when my back hurts and when I'm menstruating. So let me show you. It's like a fascial maneuver from the ground. So if possible, you'll get on the ground. I like to face the wall like this, lay on my back, and then turn my feet towards the wall. Now to help kind of release tension from the low back and the pelvis and the SI joint, you're gonna turn your feet in towards each other. And you could sit like this, especially if you have a red light, for 5 or 10 minutes after, before, or even the entire time you're draining lymph from your legs. You can even drain lymph from your legs like this. This is a little trick bodybuilders do right before they compete to get all that liquid out of their legs so their muscles are more defined. So if you want to do this before, after, or during the lower leg draining, that will be an added bonus. Your back, spine, and pelvic floor will thank you later. And you can just do this as little recovery breathing after your lymphatic session with yourself.